Food safety is a critical aspect of public health, and in recent times, India has witnessed a worrying surge in food contamination incidents. From street food to packaged products, the safety of our meals is increasingly under threat. Just last year, in August 2024, over 250 students in Maharashtra fell ill after consuming contaminated cookies, highlighting the vulnerability of our food system. This incident, unfortunately, is not an isolated one. Reports suggest a sharp rise in food poisoning cases across India, painting a grim picture of the state of food safety in the country. The consequences are even direr when we consider the long-term health impacts of such contamination, especially on children and vulnerable populations. The situation demands immediate attention, urging us to delve deeper into the causes of this crisis and explore effective solutions to ensure safe and healthy food for all. This is not just about individual responsibility, but requires a concerted effort from the government, communities, and individuals alike. We must act now to restore faith in our food system and safeguard the health of our nation. While the recent cookie incident points towards stale or contaminated ingredients, the issue of food contamination in India stems from a complex interplay of factors. Unhygienic practices during food handling and preparation are significant contributors. The lack of proper sanitation and inadequate waste management further exacerbate the problem. Open drains, improper garbage disposal, and the use of contaminated water for irrigation create a breeding ground for harmful bacteria and parasites. Furthermore, the presence of microplastics in our food chain, particularly in staple foods like rice, is a growing concern. A recent study found an alarmingly high concentration of microplastics in Indian rice, raising concerns about their long-term health effects. This, coupled with the overuse and misuse of antibiotics in agriculture and animal husbandry, has led to the emergence of antibiotic-resistant bacteria, making treatment of foodborne illnesses even more challenging. The consequences of food contamination are far-reaching, impacting individuals across all age groups. However, children, the elderly, and those with compromised immune systems are particularly vulnerable to its effects. Their bodies are less equipped to fight off infections, making them susceptible to severe complications from foodborne illnesses. Diarrhea, one of the most common symptoms of food poisoning, can be particularly dangerous for young children, leading to dehydration and malnutrition. The long-term health implications of microplastic ingestion are still being studied, but preliminary findings suggest potential risks to the digestive system and overall well-being. In a country like India, where rice forms a significant part of the daily diet, the high concentration of microplastics in this staple food is a cause for serious concern. Addressing food contamination is therefore not just about preventing immediate illness, but also about protecting the long-term health and well-being of our future generations. Tackling the issue of food contamination requires a multi-pronged approach involving individual responsibility, community action, and stringent government regulations. Personal hygiene is paramount. Washing hands thoroughly before handling food, consuming purified water, and ensuring food is cooked properly are simple yet effective ways to prevent contamination at home. At the community level, maintaining cleanliness in public spaces, ensuring proper waste disposal, and promoting hygiene awareness are crucial steps. Street food vendors, an integral part of Indian food culture, should be encouraged to adopt hygienic practices. The government has a crucial role to play in implementing and enforcing stricter food safety regulations, improving sanitation infrastructure, and raising public awareness about safe food handling practices. Regular inspections of food establishments, strict penalties for violations, and investment in clean water access are vital steps in the right direction. Furthermore, research into the long-term health effects of microplastics and the development of strategies to mitigate their entry into the food chain are crucial. Combating food contamination is an ongoing battle, demanding a collective effort to ensure the food we consume is safe and nutritious.